Can you guys all say Team Say on 3? 1, 2, 3.
Hi, I'm Mariann. Welcome to Teen Say. This is so exciting. We have Dr. Russell Libby with us. Yeah! I've tried to interview him after producing his show for 3 years. I finally got him. Unfortunately, we got him with a very bad disease. We need him to help us understand coronavirus a little.
So coronavirus, it has taken the nation by storm for sure. It is a very significant viral infection that we know started somewhere in China and not too long ago. It's one that can create serious disease, but probably more important is that it's one that our immune systems have never encountered. And unlike flu, where we have treatments and vaccines, this particular infection is very contagious, can be very serious in a very limited but significant group of people in our population, and is so easily spread and so rapidly spread that it's created an international issue, of course. The biggest thing, of course, is that, well, we don't know how to respond when we get this kind of novel infection out there, and the public has really panicked. The international news media has really taken advantage of the moment. We have a real news cycle that does repeatedly throw in our face things that are worrisome, that are concerning, and we keep hearing over and over again how terrible this is. It is a terrible thing. It is something that people need to be aware of and understand what implications there are. So I think the first thing to say is that for most teenagers who really are healthy kids, you don't have a lot to worry about relative to catching this infection. Doesn't mean that some don't get really sick, some do, but even with flu that can happen. With this particular infection, some may be more susceptible, those who have really chronic kinds of illness, bad asthma, cancers, and on chemotherapy and other kinds of treatments that might interrupt their normal immune response. But most people are going to do okay. The real issue is those older folks, in particular those over the age of 60, and especially those over the age of 80, and add to it certain kinds of chronic diseases, people with diabetes, lung disease, or cancers or other kinds of things. If they catch this disease, the mortality or death rate is pretty high. So the big fear is if we have a contagious disease that spreads through the population, that those people will be infected and they could die, or at least get really sick. It's a huge risk factor, and we don't really have a good way to contain it. So you're hearing a lot about it. You're hearing a lot of plans. It's interrupting a lot of things that are going on in this country right now. The NBA just announced that they're suspending their season. Chances are there will be lots of other sports leagues that do that. The NCAA is playing before a ghost audience. Yeah. It's tough stuff. And right now the schools don't know really where they're going with it. So this is a virus. A virus is not like strep throat. It's a different kind of thing. It's more like influenza. This is one that we've never seen before and that we really need to have some kind of awareness as to how to handle it. So you were going to ask more.
I was.
Yes.
I definitely was.
Okay.
So I'm going to borrow this. We're going to share. So the kids have lots of questions. Adults, parents have lots of questions. So the kid with, I guess, the average asthma, when they're using an inhaler during sports, are those kids more susceptible?
I would say that those kids are probably not more susceptible to severe disease. I would expect that we need to get more experience. What we have seen thus far, and it's only been a couple of months of observing this in countries where we don't get a lot of great and reliable information. So most of this is just secondhand reports, and we have not seen much disease in kids, especially in this country. So the likelihood is low that those with most of the kinds of things that kids will get, asthma, other kind, acne, being on medicines for sinus infections or other kinds of infections. I don't think that our teenagers and the younger kids are at great risk, and we have not seen significant disease or outcomes that are worrisome in kids in other parts of the world. But once again, kids are the greatest vehicle. They like to socialize. They don't always pay attention. They don't pay attention to hygiene. So sometimes they'll touch surfaces, then touch their nose, touch their eyes, and boom, they'll get a little infection, but they may not get that sick, and they'll be the ones who can spread it to other people. And that's where the big risk with teens and kids are, much more about what they can do to the community than what the disease is going to do to them.
Stop
the spread. So the moms are asking. They have little kids. So our audience is moms and dads and teens. And I got a few questions posed to me. They wanted to know about, the little kids. So I know you're saying in other countries we haven't seen a lot of little kids that are getting it and getting sick. But let's say people are not going to stay home. They're just not used to staying home. Let's say they go to the park. We saw kids yesterday in the park. I mean, the parks are full with kids. And if, in the areas where school is closed. So if school is closed and they're in the parks and they're outside, do we know anything about the germs outside? Or if we put masks on, can they go outside and socialize?
So the best way to interrupt disease is to not allow spread. So that's why we are restricting, or the public authorities are restricting large collections of people. So sporting events, concerts, even in restaurants, they're spacing out tables and chairs so that people aren't that close to each other. There is a concept that says 6 feet. Well, it could be 6 feet or 6 feet under, meaning that you stay 6 feet away, you're not likely to get a droplet if somebody sneezes or coughs that would then be capable of infecting you. That's great. If you're a lot closer, or you're sharing secretions, saliva, coughing, or whatever it might be, you do run the risk of getting this disease. Now, once again, it's been reportedly very, very mild in kids, but we may see that change, and we just have to keep our eyes open and be careful. The most effective way, once again, to stop this disease is to interrupt its transmission, and you can do that in 2 ways. One is, of course, to stay inside, or to stay in small, let's say, gatherings, and not get into the large crowds where you might be exposed to people you are not aware of who would have the disease. And the second is hygiene. And hygiene is a really important concept. Hand washing is by far the most effective way to get rid of viruses and other things that are on your hands. And interestingly, just running water with some soap and singing happy birthday to you twice will give you a very, very clean set of hands that are not likely to be carrying any virus. You asked about wearing a mask. Well, most of the time people think of masks as ways to prevent yourself from getting infection. And the only good thing that will do is to keep you from touching your nose and your mouth. It will not necessarily keep out the potential for infection if you get a good cough in your face. Your eyes and breathing through the mask actually does put you at risk. If you are sick, though, as well, it keeps you from using your nose and mouth as a source to contaminate surfaces, as well as keeping you from coughing into other people's space. So that is a really important quality. It does last a fairly long time on clothing, so yes, it's good to cough into your sleeve, but the fact is that it will stay there, and that becomes a source of potential contagion or virus for other people. So
how long can it stay on your clothes?
It's been measured at least 8 hours.
Wow.
So it probably is longer. So your washing in hot water is important if you have been coughing into your clothing. The other thing, of course, is on inanimate surfaces. It can last, some people speculate, up to a couple of days on certain types of surfaces. So
Clorox.
got to clean those surfaces if there is the potential, or you're in a public space, doctor's office. It's nice if they have plastic chairs and they can clean them with a disinfectant in between people coming in and out. Important ways to contain that. Yeah, no, we are being very careful about this. It's a very scary thing, because the other thing is that testing is not an easy thing to get. So we have not really figured that out locally. They're saying you can get tests, sure, but the way you get tested and the implications of testing create all kinds of real problems for physician offices. And currently, the health department and the hospital have not stepped up to help that process for the community. So we're hoping that we do see some movement that way, because we're at a fairly crucial time to be able to identify and understand how significant its impact is in the community and how many people really have this. So teenagers, you guys can prevent spread by minimizing those opportunities to be in large crowds. Make sure you know the people you're around and that they haven't traveled someplace.
If they're hanging out with the same group that they hang out with every day, their girlfriend, their best friends,
Yes.
And all of that, or their boyfriend, and and there's small groups. Can they still do that? Because odds are, if any of them have been contaminated, they're all contaminated anyway.
Yeah, unfortunately, you're right. So it's always worth making sure you know who you're around. It's good family time right now. It's not an easy thing to do. Kids have been sent home from college. The most wonderful experience of your little young life, and here you can't even finish out your first year. That's sad. But it is the state of the affair right now, and we have to respect that. So
and take it very seriously.
oh yeah, we do. Yes. Yeah.
I don't know if any of them know it, but the moms out there do. It's not an episode on Grey's Anatomy. This is not going to go away with a quick.
Right. We have no idea how this will unfold. We're hoping that as we head into the spring and then summer season, that interrupts the potential for transmission. It may make it less likely that you get easily infected, but this is not over. There's a lot of changes that we need to go through and understand that this is impacting our routines and our lives. We have to play it safe.
Should close restaurants and just stop?
Well,
going out, period.
I think that you have a situation where that is going to be decided on the fly. Right now, we can do a lot by being cognizant and aware of the potential for spread and easy spread, and understand why these restrictions are being imposed upon us. Kids are going to be anxious anyway.
To go to the mall,
and they're going to want it. Yeah, it's not easy
out.
to stay home and hang out with your parents. I understand that, but it is a time where we have to take a deep breath, but without somebody else's breath in our breath, and make sure that we recognize and realize that this is a significant time in human history. Will we learn how to respond to these better in the future? Yeah, I hope so. Some of you might be worried about what's going to happen with my college and my applications, my grades. This may be something that has to be dealt with later on. I can guarantee you that if you've been doing well and you're earnest and a good student or an athlete or whatever, right now this interruption is what everybody's experiencing. So it's not like somebody else is being able to take advantage of the moment and surpass you. Once again, it's one of those things we have to stay tuned in, and there are a few places you can do that. There's a lot of misinformation out there, and certainly it's easy to get sidelined and really worried.
Hysterical?
Anxious? Yeah, no, that's for sure. And there are lots of internet banters that are going on that don't necessarily represent accurate information. The CDC, Centers for Disease Control, everybody's favorite science-based institution that helps direct and guide the way we address infectious diseases and health problems in the country, has a great website full of a lot of information, cdc.gov. You can go to the Fairfax County Health Department website. You can go to the Virginia Department of Health website. You can really look to the hospital for some information, but it is not something that is yet necessarily in your repertoire of your Google searches. But nonetheless, be reassured, your public health folks are trying the best they can to try to ramp up a response that will help us stop the disease in its progress and make life a little easier and get us back to normal as soon as possible. But that can't happen without you guys helping support the hygiene and right now the lack of social opportunities that are coming with this.
Should they be prepared? I mean, should the average teen and child be prepared that there's going to be some grandparent deaths happening?
It's really hard to speculate on that. I think what is most important is that people sort of inhibit the opportunity to bring the disease to people who would be most susceptible to significant outcomes. So you want to make sure that if you're sick, you stay home. You have that cough and fever, and typically it's not particularly a congestion-oriented disease. It's much more cough, shortness of breath, fever, tiredness, but not a lot of nasal congestion and runny noses. So that's one thing. But if you are sick like that, stay home. Don't think that I'm not feeling that bad. I can go out or I can go see grandma because we have dinner plans. It's best that you guys stay separate and that you respect the symptoms that you might have that could be related to the coronavirus.
So if a teen feels bad right now, it's allergy season too.
Allergies are different, very different. They itch, you get a runny nose, you may get tired from your allergy and allergy medicine, but it's a totally different experience. It's not coughing and fever and real tiredness from feeling sick.
So is this almost like a mono that they'll
No,
feel?
this is much more like a flu, which typically doesn't necessarily have a lot of a runny nose feature.
Are they using antibiotics? Can we, if somebody is contaminated with coronavirus, can we request antibiotics to help?
Antibiotics are not helpful in viral infections. And this is a viral infection. There are very few viruses that have specific treatments. As we said, flu, you always hear of Tamiflu. That's what you use to treat influenza. But there's not been a medicine yet that has been developed that can treat coronavirus. So unfortunately, no, antibiotics don't help. And they
Do
are.
we know though? Have they tried
We
it?
know, absolutely know, yes. They are not appropriate for use in these kinds of viral infections. And if they are, it's because you're in the hospital and you have a complicated secondary infection like a pneumonia. You're not going to be getting these things as outpatients. They don't need antibiotics, period.
Well, Tamiflu, have they tried Tamiflu?
They have tried Tamiflu. Tamiflu does not work.
Wow.
But there are some drugs in the pipeline. There are definitely vaccines in the pipeline. And hopefully, if this continues to be an issue relative to the virus itself, within a year we should have a vaccine that can help us build up our own immunity so that we would not be susceptible and we could stop the transmission, because that's what a vaccine does. Creates immunity in every individual who gets it so that they don't get the disease and they aren't capable of spreading it. And when you hit a certain level of population that is vaccinated, that prevents that virus from then spreading to a lot of people and causing a big problem. Very important to get vaccinated. And flu vaccine every year is still really important.
The gyms are not closed. So there are a lot of companies that are closed, have their people working from home, but then they're all going to the gym. So, I mean, if, the government doesn't make the gyms close, people should choose not to go there.
And once again in the gym, they say 6 feet apart, don't cough and sneeze and do the other things that can spread disease if you're sick, for sure. Don't go to the gym if you're sick. If you do go to the gym, make sure you have the wipes and you wipe down all the equipment before you touch it. Very important quality. Very important to understand that this is something that you can get from just touching and then touching. So you don't want to contaminate yourself. You're in places like that.
So, Dr. Libby, we know you see babies.
Yes.
These precious little
Babies.
yeah.
Yes.
So moms that are carrying right now, are they more susceptible? And what does it mean for the baby?
So all we have right now is information from China and some of the other countries where we've seen the disease. And it does not at this time appear that pregnancy has made people more susceptible or given them more severe disease. And thus far, we have not seen newborns affected by the virus. There's a lot to learn and a lot to observe, and there's not a lot of information yet that gives us a total set of confidence. But nonetheless, it seems that at least if you're worried and you're pregnant, that you can take a breath on that one as well, that it hopefully will not be something that we get really upset about.
I do have one last question for you. If people have to go to the hospitals for treatments, for cancer, for whatever they go to the hospitals for on a daily basis or on a monthly basis, should they be really scared?
No, I don't think you have to be scared at the hospital. And in fact, there are lots of screening methods that we are employing. I know when you call our office, we will ask a series of questions about exposure, about travel, and about the likelihood of the symptoms being suspicious for coronavirus. And if they are suspicious, then we will often do a screen using a telemedicine platform, which is one with a video screen and an interview that then we can decide.
With a doctor?
With a doctor, yeah, whether you need to come in for that or not, and or whether you need to get testing. And once again, testing is not a clear process at this time. So hopefully by next week, we'll know more about where and how to get testing done, so that people who are worried or have a suspicious situation might be informed, so that those people around them can then stay home for a couple weeks and keep that disease from being spread to other people. It is, it's a difficult situation, but nonetheless, hospitals are trying not to see people in their waiting rooms who might be suspicious. So there is a triage process, which means that we're screening people before they actually get seen or come into a facility to try to weed out those who might be at risk.
That's awesome. Yeah. Are doctors worried?
Are we worried?
For you guys. I mean, the healthcare profession, how do you guys feel? Besides overwhelmed. You've got to be overwhelmed.
Well, it is, as with you guys, the uncertainty of what to expect and where we're going with this. There is a need and a commitment as a medical professional to take care of patients no matter what the situation. So we are here to take care of you, and we will put our lives on the line to make sure that your lives are well addressed and that you can stay healthy. So we'll do what we can to make sure that we can help you. But yeah, it makes us pretty nervous, and when we go home at night and hug our spouses and our children, that's a little worrisome. And if you're an old guy like me, you know, you worry a little bit. You still fit the picture where you can be severely impacted by this disease. So yeah, we worry, but we're trying to do our best to make sure we provide the service our patients need. Right?
Right. Thank you.
Good.
Thank you for everything that you guys
Sure.
do.
Yep.
And we will all be praying that you all stay healthy. Thank you, Dr. Libby, for talking to us. Dr. Libby from Virginia Pediatric Group. Well known, 3 offices in Virginia. I'm sure he's been 4 offices.
Yes, sure.
I'm sure somebody you know has seen Dr. Libby. So take his advice, stay home, try and get well. Any other advice?
Nope, just carry on.
Until the next time?
Till the next time.
And hopefully
Right.
we will not be talking about coronavirus again. And hopefully maybe within a month of isolation, this will go away.
We can only hope. Yes.
Think it'll be longer than a month?
It is likely going to be something that we deal with over the next year to 2 relative to its pockets of transmission. It will go to the southern hemisphere. It will go to different places at different times of the year. And it may rear its ugly head again next winter if we see a little relief. Hopefully by then we'll have a vaccine or at least some medicines that we can use in case.
Wow. So we were all thinking a week or 2.
Good luck. I'm hoping. Yep.
Thank you, Dr. Libby.
Stop the spread.
Yeah.
So our advice here from Teen Say is
Try and stay out of the stores. Try and listen to Dr. Libby. Let's stop the spread if we can. So guys, what do you want to tell them one more time?
stop the spread.
Stop the spread.